Welcome to Rising Above It. Thanks for joining us today. I'm your host, Nancy Seagal. And today's show, we're talking about rising above cancer. I'll also be sharing with you 7 mental tips to break through the odds. So today we have a guest, a special guest, who has survived cancer. And I myself has survived my own crisis with health, and that is with mercury poisoning. However, today's focus is cancer. I'm a hypnotherapist as well as an author, and I'll be sharing some information about my books later in the program. I also help people to heal and also to prepare prior to a crisis. So let's get started, and I'd like to introduce my special guest, Boris Romanowsky. Boris, thanks for coming here and having you on my show. It's been an honor. So Boris is a parole agent. He's also a private investigator. He has 30 years on the Department of Corrections and with the State Patrol. He is a survivor of cancer. So Boris, tell us about yourself.
Well, first,
adversity.
I'd like to thank you for having me on the show. I appreciate it. It's very nice of you. The cancer began to affect my family specifically in 1996. My mother was diagnosed with colon cancer at age 68.
How old were you at the time?
Well, I was 40. No, I was 39, I believe. Okay. Yeah, these are rough numbers.
Okay.
Yeah.
No one's holding you to it.
Yeah. Well, my mother was diagnosed with colon cancer in 96, and she died that year. She died in about 3 months, and shortly after that, my aunt, her sister, died of colon cancer, both at about the same age, between 68 and 70 years old. At the time, we didn't see a link, or we didn't really recognize that there might be a problem as far as a potential genetic link. But 10 years later, in about 2004, 2 of my brothers were diagnosed, and both of them passed away in 2005. And then I was diagnosed.
So it was very quick.
Yeah, and then I was diagnosed in early 2006, but I caught my cancer, the same cancer.
And you had the colon cancer as well?
Yeah, I had the same colon cancer, but I caught mine at an earlier stage.
Okay, and that was stage, what stage?
Stage 1.
Okay, and your brothers were at?
Stage 3 or 4, but certainly advanced.
Okay. So, very good. So what do you think caused the cancer that runs in your family, or seems to run in your family?
It appears it's probably a genetic link, but that has not been confirmed, but it acts as a genetic cancer. So far, it's being treated and screened as a genetic cancer, and as science moves forward, I'm certain they're making advances in the DNA, and we'll probably be able to eventually determine exactly where the link is, but it does appear to be a genetic link.
Okay, and they consider a genetic cancer to be an abnormal gene that's a piece of the DNA that's passed along from generation to generation, and so it's inherited. And the gene, let's be clear about this, the gene can lead to cancer. It doesn't necessarily mean that you will get cancer. So there's a big difference in that, is that it's a possibility, and you have a you're predispositioned to possibly getting the cancer.
Certainly. It's not an absolute. I have older brothers and other family members on the same side of the family that have 0 cancer. But it does increase the odds, and it certainly calls for preventive medicine and early diagnosis, if possible.
Yeah. According to the American Cancer Society, about 5 to 10% of all cancers are inherited, which doesn't sound like a lot. But when you think of the almost 7 billion people in the world, that's a big chunk to have 5 to 10% of the cancers that are inherited. So I think medical science is actually developing and discovering that more and more about cancer as the research uncovers.
Oh, certainly. And I was involved with City of Hope, the genetic study over there, as I still am, City of Hope. And
tell us about City of Hope a little bit.
Well, I'm not authorized to speak for them. I was
Sure.
just mentioning that I did participate in their genetics program also, which is an ongoing program. And
They're a research center.
Yeah, the research and treatment. They're one of the leading cancer centers, certainly in the nation, if not the world. And then I was involved with studies at UCLA also. But in regards to the genetic research, it's certainly an ongoing scientific procedure or mission. And the City of Hope, they are one of the leaders in that field.
So you were in good hands.
Yeah, I was in good hands. Yes,
Okay.
I was in good hands.
Okay, so how did you find out about the predisposition possibility of cancer and that runs possibly in your
Well,
family?
I mean, my mother passed away from colon cancer, my aunt and my two brothers, two of my brothers, so that was not a good sign. I went in for, when my brothers were diagnosed, I went in for a colonoscopy, which is considered the one of the most effective measures to detect or locate cancer at its early stage with that type of cancer, colon cancer. I had the colonoscopy. I was essentially cancer-free. A small polyp was removed, which is not abnormal at my age. I think I was 46 when I had the first one done, or 45.
And explain to the viewers what a polyp is.
Well, it's a growth, not always cancerous, most times not cancerous, a small growth on the inside of a colon.
And that's detected through a colonoscopy.
Yes, through a colonoscopy, and it's generally reserved for men and women at or beyond the age of 50. But if it appears there's a genetic problem or a existing problem, it can be done, and in many cases should be done earlier. In any event, my first colonoscopy, I was about 45, and I appeared to be fine at that time.
You didn't have any other symptoms. You didn't show.
I had one small polyp that was removed, which is not unusual, and it was benign. And then, generally speaking, you would wait. These are general terms. You would wait 3 to 5 years before another colonoscopy. But however, within 6 or 7 months, I started to feel something.
You have a story about a polyp story, and I'd like you to share that with the audience, because this makes a big difference whether going by the standards of when you should actually get tested and trusting in your own self and trusting and believing and knowing your own body and listening to it. So go ahead and share your story.
Well, what happened with me, my first colonoscopy, as I said, I had the one small polyp, which was benign, which is, that's not too far from typical, not alarming at all. But within, I think it was 6 or 7 months there after the first one, I began to feel what I thought was, I had a feeling around my waistline on the left side, very light. It was almost like somebody was touching me, just as the fingertip was touching me. I did explain that to my doctors, and
what did they say?
Well, the general feedback, I believe they thought that maybe I was a little paranoid, and certainly I wouldn't be able to feel it. For certain medical reasons, you probably shouldn't be able to feel it. It has to do with nerve endings, they're not inside the colon. But in any event, I thought that I felt something, And I brought it to their attention a number of times, and I eventually was able to push hard enough to get another colonoscopy through the doctors and the insurance. And
what time period was that?
To get the second colonoscopy from the time I thought I felt something, it was about 3 months. And
So that's pretty quick. And that time between the last colonoscopy was?
It had been about 7 months.
Okay, so it was very, very quick.
Yeah, it was very quick.
And they didn't spot that polyp?
No, it wasn't
first
there
one?
the first one.
Okay, so
And
interesting.
the doctor did say that did the colonoscopy. He said it appeared at an alarming rate, but they did find it. It was there. It was a little bit larger than they anticipated, and it was cancerous.
Okay.
And the same or similar type of cancer that my brothers had. So we were able to determine that it was in fact cancerous, and then I had to make a decision in regards to treatment for that. And that's what I did.
So you got treated for it?
Well,
You removed
I elected to have a colectomy as opposed to cutting a section from my colon. I had a colectomy. I had 3 different opinions. I went to the City of Hope, UCLA, and another hospital, and they all kind of concurred that they thought the colectomy was the best way to go. Radical surgery, fairly serious surgery. I had that done at UCLA, and I had that done within 30 days of the diagnosis. So,
Goodness, that's
yeah.
very fast.
Yeah, it was very fast. They wanted to do it before it spread.
Okay,
And
and
got
so
into the lymph nodes.
you took care of that, and you've got a clean bill of health since then, right?
Been 6 years, yes.
Wonderful,
Yeah.
congratulations.
Thank you very much. Yeah. No, I'm
That's
fine.
excellent.
I'm
That's
fit as a
excellent.
fiddle, and run, jump, do marathons. I'm fine.
Great. So let's go to the mental side of dealing with cancer and what you had to endure mentally, emotionally, besides just the physical pain and discomfort. And so did you know of any difference between your attitude towards, between your brother's attitudes towards the cancer and your attitude? What were your attitudes, I guess, is what I'm asking. And
Well, I was fortunate. I was diagnosed very early, and I didn't experience the pain other than the surgical procedures. But my mother and my brothers experienced the tremendous pain, and the they went through much more than I did. The 3 of them all displayed fantastic attitudes.
That's good.
They did great. They fought as hard as they could. They stayed positive. They elected to use aggressive treatment, anything to try to survive, and they did an excellent job. But unfortunately, the cancer was too far advanced. In my
they were
case,
just diagnosed also at a later stage.
yeah, they
too,
were
which helped,
diagnosed at a late
makes
stage.
it a difference, too.
And I, having just seen my 2 brothers pass away, I was kind of in a hurry to get mine healed, cut out, cured, and get back on board and deal with other family matters. And so I think through positive attitude and a bit of a sense of humor and training and diet.
Going to that, how did you beat the odds and recover from the cancer and from a mental standpoint? I know you carry a attitude of gratitude, which is excellent.
Yeah, it's a term for me, but it's a good term, and I've always believed in an attitude of gratitude. Before my illness, I believed in that, and after seeing what happened to my mother and my aunt and my brothers, and then almost to myself, it only confirmed to me that the attitude of gratitude is probably a good thing to have. I was thankful for my health. I could have passed away probably had I waited longer to get treatment, and I'm glad to be here today. The surgery went fairly well, and I'm here to talk about it.
Great.
And
Thank you for sharing. It's an important subject. And how does your family feel about the discovery of not only you having cancer? You have two daughters that you have, and as well as many other siblings, from what my understanding. And what's the general attitude of your family and their?
Well, the general attitude now, I have a very large family, lots of nieces and nephews scattered all over the state. The attitude is good. Everybody's being very proactive, trying to stay in shape, trying to get early treatment, trying to maintain positive attitudes, and everybody's doing what they're supposed to be doing to help avoid the same or similar.
Okay.
And
there must be some level of type of fear or worry to some degree, and how do you calm those fears and worries and anxiety that they have to cross your mind, they have to cross say your daughter's minds, and in respect of what if, and what do you do and say to them to help them?
Well, I don't know what has brought it about, but all of them seem to have a very positive attitude. They all maintain a sense of humor, which seems to go a long way. They're certainly concerned and aware, but they do not appear to be extremely negatively affected by it. It's just, okay, this is what I need to do. And part of my reason, I'm kind of the patron now. A lot of my brothers have passed away, so I have shown them, if in fact you do get it and you do catch it early and you do have the same or similar or a different treatment depending on the advancement of medicine, that you can beat colon cancer and you can thrive. So they seem to be adjusting very well.
That's very good. Yeah. It's very good. Sounds like a very healthy attitude that runs in your family from generation to generation, and that's very important to have that attitude. And in a few moments, I'm going to share the 7 mental health tips that you can have. And but before that, I'm going to ask Boris a couple more questions. And I want to touch on the work situation. Because you are a parole agent and a private investigator, your stress level may be high, I would imagine.
I think it's extremely high.
and how you dealt with work, your sick leave, and also insurance issues, how that played in a part of going through the experiencing cancer.
Well, I was very fortunate in a lot of ways. My work insurance is very good. I have so many years with the department. My coworkers and the department were fantastic. I took about 6 months off of work during my treatment and surgery, and I took time off to assist my brothers, sick family care and stuff. So the entire department and all my other parole agents stood beside me. I actually exhausted my sick leave. I had no time left, and probably hundreds of hours were donated to me to get through it. So yeah, they were fantastic.
It's important to have that support when you're sick.
Yeah.
I can speak from that experience. I didn't have very much myself, but when I did have it, it meant the world to me, and it helped in my recovery of overcoming the mercury poisoning. So definitely reach out, and if you have cancer or any other debilitating illness, is to reach out and ask for support and find it.
Yeah, I had to do that, and I was overwhelmed. with the support I received. It allowed
That's
me
excellent.
to recover and take care of my family simultaneously. And so yes, it was fantastic.
That's good. And so what do you do now mentally and physically to keep yourself healthy?
Well, I try to eat right. I exercise a lot. I try to maintain a positive attitude. If I do get down once in a while, I try to make, because I am human, but I try to make sure it's just for a minute or not even a day. I try to catch myself. Thank God for all the blessings I've had. I have survived to over 50 years old now, and I know
Congratulations.
there's a lot of
You're doing
younger
great.
people who don't make it, and I'm pleased to be here, and I try to appreciate all the great things that we have, especially in this community, all around the world. But we live in a great place, and I plan on being here for a while. But if that changes, I still want to maintain a positive attitude as long as I can.
Excellent. Okay, let's get to the mental tips. We have those up on the screen. So, okay, there we go. 7 mental health tips to beat the odds. And tip number 1 is Boris's favorite, positive attitude of gratitude. It's important that you keep in mind that good things do come from negative situations, and it helps you to learn and grow and appreciate life itself in general, as well as your loved ones and your life and surroundings. So let's move to tip number 2. Trust and believe in yourself. Just as Boris experienced, listening to your body, knowing yourself, always go with your gut instinct. You know yourself the best. And tip number 3 is Okay. Tip number 3, the power of prayer and spiritual beliefs. You have to accept what is, and that's okay, because sometimes we can't control what we experience in life, and it's beyond our control. So the power of prayer is very comforting, and it brings us hope. And it's a great tip to remember is to have something to look forward to reach out from something that's greater than us as humans. Tip number 4 is to avoid being the victim of poor me or why me. It's important to be proactive and listen to your negative self-talk, because if you get stuck in your negative self-talk, it will keep you stuck exactly where you're at, and you will not go any further. So in other words, eliminate the negative talk, catch yourself, and turn it into positive thinking. And tip number 5, keep a sense of humor, something Boris and I know very well. The good thing about keeping a sense of humor is that it boosts the immune system, it lowers stress, it improves the mood, and it's also free and it's also fun. So why not have some fun while you're going through a crisis? That's my attitude.
That's good. It helps.
Also, tip number 6 is to focus on a solution. Oftentimes we get stuck focusing on things that are going wrong and how much turmoil is going on around us and within us. And so it's important to be proactive, be resourceful, because there's always new ways to deal with different things. Just keep searching, and you can find things through your support, through organizations. And also a great tip is to visualize that yourself as being healthy and energetic and living a normal life. By visualization, you can further your yourself and your healing process, and you'll have better results than if you eliminate it out of your daily activity. And tip number 7, our last and final tip, is let negative emotions fuel determinations to beat the odds. So don't let anger fester within you, because oftentimes when we're facing a health crisis, we feel a lot of anger, whether it's towards ourselves, towards others. It can be anyone. Also, by letting go of that anger and using it to fuel the determination, you'll be able to shift, and that will make it much easier to cope, and you'll gain strength and resilience from it. So, before we end the show, what advice do you have for our audience?
Well, I would advise or do advise early checkups, early treatment, check with your doctors, and probably the age-old ones is exercise, diet, and check with your medical provider. And if you have friends and family members that are having the same or similar problems, you can help them by supporting them and being close to them and having empathy and sympathy, because it can be tough out there.
Excellent.
Especially those who are going through chemotherapy. It's extremely difficult. Transportation, just
things that we take for granted.
Oh yeah, they need a lot of help.
Even day-to-day living, transportation. It's endless, actually.
Yeah.
Sometimes the littlest things are the most important things. So support is very, very important in times of crisis.
If you do have a friend or family member that's going through that, they need a lot of help, whether they ask for it or not.
Yeah, very good. Well, Boris, I thank you for being here today. Your subject is very important, and thank you for sharing and opening up to the audience and sharing your experience with everyone. Before we go, I'd like to share some information about my books. One is Rising Above It, and the other is Rising Above Mercury. This is my newest one. You can order them on risingaboveit.com, or you can find it at your local Santa Barbara bookstore. They are now in bookstores locally here in Santa Barbara. You can find them at Chaucer's, The Book Den, Paradise Found, and Tecolote. And remember, when life gets you down, you hold the power to keep rising above it. Thank you very much for joining us, and I look forward to seeing you very soon in the future. Thanks, Boris.
Thanks again.